Friends, it's time to elevate and thrive. Welcome to the new podcast from Sage Integrative Medicine Clinic. I'm your host, Barry Napier, along with my co-host, founder, and medical director, Dr. Angela Yeagley.
Hi, Barry.
Angela, welcome.
Super excited.
Yeah, I'm so pumped. New podcast.
I know. New year.
New year. So many fun things to talk about.
Great things.
And I thought we should kick this show off with some of the treatments that we're most excited for in 2022. Because I know we have some new stuff that we're offering in the clinic, and we have some old favorites that we're really focusing in on more this year.
Mm-hmm. Yes, I love it. I'm super excited. So I want to talk about, of course, we do a lot of things here, and which are super exciting, but we do have some new things. And I want to talk about a couple of therapies too that even though we've had them for a while, I'm finding them to be more relevant, with just, learning more medical research, seeing more people, seeing more things that are relevant for people to kind of reach their goals. So I don't know. Should I dive right in with the first one?
Absolutely. Let's dive right into the one you're super excited about. It's you've told me a little bit about it,
yes.
But why don't you bring it to life for everybody else?
Okay, so the first one is IV NAD, and so I'm not going to spell that out because it's a long one. I'll just tell you that it is a version of vitamin B3. The super exciting thing about it is that it's like a super energy maker, and so when people have this therapy, they feel amazing, and so we're starting to bring it in more. So this is a treatment that we've started offering more recently. And while we know the benefits around the research around it, like what it's supposed to do, we're witnessing that, which is really cool, and watching people, from all levels of energy, like people that really don't have a whole lot to people that already feel pretty good, that makes them feel even better. And the reason why is just because it's basically an energy molecule. So when we think about, probably most people aren't thinking about their cells, but if you know anything about cellular metabolism, most people know ATP. NAD is one of those other energy molecules.
So when you get this type of therapy done, is it something that is it like an immediate energy boost, or is it a gradual thing that lasts for a few days, or is it like you're crazy amped up, you have tons of energy for like 2 days and then it goes away, or what's the experience like?
Great question. So of course, like with anything, I would say it depends. But I would say the average person. So if somebody isn't completely exhausted or dealing with some major chronic illness, their first treatment, they're going to notice it. Like it's going to be really good energy, and you're going to experience it right away, and it's going to last for a while. Now, many times, like as you go further in the therapy, it's going to last longer, and that's usually how things work, with IV therapy. So the first one is good, the next one is better, right? They build upon themselves.
So much of, I feel like naturopathic medicine and so many of the treatments we offer here kind of fall into that category where the true benefit comes over time, not necessarily just the first time.
Very true.
Good, but then,
yes.
And there's some other treatments we're going to get to today that we're really also excited about. We're going to talk a little bit about later in the show that kind of have a similar idea. The longer you go with them, the more benefit you get. Yes.
And I'm so glad that we're talking about this because you're absolutely right. I mean, unfortunately, there really isn't one therapy where you can just have one.
That would be the magic pill theory, right? I mean, we all wish that thing existed.
It just be billionaires,
right?
You
do it one time, you get the one shot, or you take the pill, and it just boom, the problem goes away. It never
Wouldn't
comes back.
Wouldn't that be great?
It's such a great idea, such a great dream. Well, until that dream comes to fruition, we have IV NAD. Yes. I'm really excited about this. This is a therapy you had talked to me about, and of course, I love to guinea pig as many different therapies as we can. And
I'm so glad.
Kind of report back to the people out there that are patients what my experience is, because I'm really kind of coming into it as more of a patient experience versus a practitioner experience.
Yes.
And this one was interesting too, because wasn't this hard to find for a little bit?
It was,
supply shortage.
Yeah, actually, I mean, for people that have heard about it, like it was kind of really big. I would say maybe like 5 or 6 years ago, and a lot of people that you might think of that are biohackers or really well known in that space, like Dave Asprey or Mark Hyman. Like they were really, and they still are talking about that it's amazing, but I think it just really rose in popularity, and then for a while you couldn't find it. It was really difficult. So but now it's come back, which is great, and it's easy to get, and the cool thing is, I mean, because we are, we treat a lot of people that have a lot of different types of conditions, not saying that we don't get people here that are looking always, they feel great and they just want to optimize. We do, but I would say a lot of times people are coming in with something, right? They're not feeling their best, or they have something like mold toxicity, or they have an autoimmune disorder, or they have, another chronic condition. What's awesome is that we see change, and this is like an element that we can bring in that gives those cells energy to do the repair, like an autoimmune, or to help the body detox that mold, or to help the body like move things out that shouldn't be there, or again, just generally repair. But if you're mainly you just want to feel awesome, you can do that too. That's fine.
Yeah, it's typically the situation where when you're going in to see your doctor or any doctor, it's generally not yet. It's like, hey, I'm feeling the most incredible I've ever felt, but I want you to make me feel even better than I already feel today. No, it's usually you have an issue going on.
Yeah.
And the NAD is cool because it can supply, like you're saying, a ton of energy that can really help in a variety of situations. The other thing that you wanted to talk about that's kind of on this same vein was another IV, another IV therapy treatment approach that's not new per se, but it's a newer focus. And what is that?
Yeah, so that's IV ALA or alpha lipoic acid. That one I can say a little easier. And that one actually, yes, we've been using for a while here at the clinic, but what we're noticing is really this one, can be used for energy. It's an antioxidant. It does repair the cells. It repairs the body. But many times when we end up reaching for it, it's in specific things like mold toxicity is probably a big one. People who've had mold exposure. But also any other kind of like neurological issue. So that could be like post-traumatic brain injury. So people have had concussions, or you're dealing with something neurological, like if somebody has diabetes and it starts impacting their nervous system. So anything, if you think of the brain and nerves, or toxins, IV ALA is a really fantastic intervention. And we start seeing that change, right? We start seeing like better, faster movement in those people who have those issues. Whether if it's like concussion, then we start seeing clarity, it starts coming out, which is pretty neat. And focus is coming, starts coming back. If it's something neurological, like say if it's numbness, tingling, we start seeing change in that and repair. Of course, nothing is a guarantee, but it has a pretty good track record actually. And then the added energy that comes from that too. So, and the same thing with like toxins, it can also be used with metal toxicity, because it helps to bind both mold and like metal toxins and excretes it. And so you see kind of more rapid improvement there and better energy. So, and you start seeing that through the test results as well. The body is better able to mobilize those things and get them out, and you can, so you see more of it.
Yeah, a lot of what you're talking about there in the detox front, and a couple of the other treatments that we want to talk about as well are very detox focused and oriented. And it seems to me that when it comes to detoxification, that I feel like it's a generally known concept, but I feel like it's a somewhat misunderstood concept as well in many cases.
Right.
I don't think people oftentimes when they're feeling sick or low energy, or they're having specific like conditions you're talking about, maybe cognitive conditions or other very specific health conditions, I don't feel like it's often a leap towards they need some type of detox regimen that is kind of very specific to their situation. It's not I've never like when I just talking to people, they're like not feeling great, they don't say I need a detox.
No, that's very true. Yeah. Unless you're maybe, sometimes we do get those people that are maybe
a little more knowledgeable maybe about that, or more oriented in that area.
Yeah, or we might, like call like hippie oriented.
Yeah, like
that's not a bad thing.
When they're thinking detox, they might be thinking like a juice cleanse or something.
Yeah,
Exactly.
absolutely. Which is a detox.
It is. And I think when I think when I think detox, I think juice cleanse or something like that. Yeah, or I'm going to cut out coffee. Yeah, or I'm going to cut out alcohol. I'm going to cut out sugar or white foods or something.
Yeah, and all that is relevant. I mean, when we're thinking detox, that is detoxing. And like, so when people come off coffee and they get a headache and they feel maybe even flu-like, you're detoxing. I mean, it's just your liver dumping things. So, yes, that's exactly what it is. So you're right. Like usually when people, you're right, when they don't feel well, they don't think like, oh, I just need to start, detoxing. But I've realized, and I know this is something we've talked about a little bit, that no matter what the condition, if there is a condition, right, if there is something going on or something that's not optimal, whether somebody's tired, or just, I'm just tired or whatever, I mean, sometimes it is just, oh, I'm not sleeping, and that's what that is. But, I feel like in this day and age with where we live and what we're exposed to, if you live in a city, although if you live in the country, actually you have more like risk of exposure of chemicals, which is crazy. So you have a higher risk of developing much higher risk of developing Parkinson's if you live in the country around agriculture, because you're being sprayed all the time, and that's pretty well documented. So whether I know it almost feels a little depressing. You're like live in the city, you get metals and everything else, but I mean it's a reality, So and some people do well regardless. We call those like our, super constitutional tanks. Like they can go through anything, and they're the people who live to 100 and something, and they're smoking and they're drinking and they're but most people aren't like that, right? Most of us need to take some intervention to end up with like the kind of health that we want to have long term, right?
Well, I think we start to see that and notice that and feel that more
Yes.
as we get into our 30s and 40s and 50s. And
For
I think,
sure.
One of the things with living in toxic environments or ingesting toxic foods are, because there are many foods that we, eat in a standard American diet that place a toxic load, we would say,
Yes.
or are produced with a variety of different chemicals or whole growth hormones, depending on where you eat your meat and where that meat comes from.
Right.
I mean, if you eat,
everywhere.
if you go to the Costco and just get the Costco meat, which I do, most people do.
Yeah.
I mean, that meat that's not like this great grass-fed, super
petted,
organic,
loved.
I mean, so there's all these different toxins all around us, a variety of different.
Yes.
And I think what we see, right, is as we age, generally, those build up.
Yes, they do.
And as they build up, they start to have more impact.
Yes.
And we start to experience the negative impact.
Yes.
And then we're like, oh, something's wrong, or I'm starting to get this or feel that, or I don't feel like myself, and specific issues come up. And that's where we start to look at some of these therapies as a part of a detoxification regimen.
Right, exactly. Yeah. We call that the cup runneth over. Like the liver can handle so much, right? And at some point, and usually it's aging. At some point, you're going to experience something. Most people will, you know, and it's time.
Yeah, we need to have, aging is its own separate topic.
Yes.
We'll do another show just on ways that we can stop
aging.
Yeah, exactly. If I want a youth episode, we'll call it. But another therapy this year that we're focusing on anew ties into detoxification as well.
Absolutely.
So we have IV NAD, we have IV ALA, which is very detox focused, and then we have another old favorite that's very detox focused.
Yes, love it.
Which is what?
Infrared. So infrared sauna. So what I'm talking about specifically is far infrared. So there's near and far. So near is going to be the one that you can feel the heat coming off of, like it's a red bulb, and people put their lizards under them, and it gives off a certain amount, but you have to experience that one. You have to be naked, or it has to be naked skin, like it won't penetrate clothes. So far will go through your clothes. So if you're in a far infrared sauna, you can, it's going to penetrate deeper, which is really nice. So sauna and sweating has been associated with longevity and reduced risk of kind of like almost every chronic illness out there, cardiovascular risk, even diabetes, and I think, there's a lot of postulate, like why does it do that? I mean, you're getting in there and you're heating yourself up and you're sweating. And the thought is, possibly detoxification again. When you're sweating, you're getting rid of like chemicals out of your skin, actually metals. You're getting rid of like excess hormone. You're just like excreting it out through your skin. So there's less impact on your liver and your lymph system and your kidneys to get rid of that because you're sweating it out. So it helps. But then there's also you get benefit from the heart is actually impacted, which is really in a really good way. Like it actually, most people notice if they get really, really hot, your heart starts beating. And what they found is that, I mean, whether you're really deconditioned or you're an extreme athlete, it will improve your cardiovascular function.
Interesting.
Yeah, because it has that much of an impact on the heart, which is kind of bizarre if you think about it, just sitting in a sauna, right? And you're improving. So,
And it's specific to infrared sauna.
well, actually, that's a good question. No, not only specifically. I mean, you can wet or dry sauna.
All has some similar benefit.
They all have, well, I mean, they all have benefit, but I don't know
Variety
if
of different benefits. Some
yeah.
detox, right?
Yeah.
Yeah, the reason I ask is just recently we were out in Leavenworth at Post Hotel.
Yes.
We stayed a couple nights. And have you been there?
Mm.
You heard about it? You've heard about it, right?
I don't think so. No.
Oh, my God. This place is amazing.
Is it?
You have to go sometime. So it's like a European spa hotel type deal. So you live the robe life. Like you get there, you put your robe on, and you basically can do everything in the hotel in your robe. You can go to breakfast in your robe. You can always be in your robe. And the bottom part of the hotel are a series. There's 3 different steam rooms of different temperatures, different like wet steam rooms, smells. One's like on these marble benches and this lavender. It's incredible.
Oh,
and then
wonderful.
there's 3 different dry saunas of different heats and different kind of the rooms are built out of different materials. And there's 2 different cold plunge pools. One's like super, super cold, like 40 something, like 50 degrees or 48 degrees. And the other one's like 55 or something. 2 different cold plunge pools. There's 2 different like hot tubs of different temperatures. There's these cold reflexology pools with like these neat different stone patterns that you walk on.
I'm going.
And there's like a swim out pool.
I love it.
It's ridiculous. It is ridiculously awesome.
There.
And very expensive, but also totally awesome.
Yeah.
So anyways, the reason I ask is because those types of things are so invigorating, especially when you can spend a couple hours, which you normally don't get to do in everyday life, going through a series of cycles of, hot sauna, steam sauna, cold plunge pool over and over again. It's amazing. It feels incredible. Yeah. And sometimes, that's obviously like this cool thing you get to go do every once in a while if you're lucky, or you make it a priority and save your dollar bills. But here, the infrared sauna is something people can access quite often.
All the time.
So how often should you be doing infrared sauna?
Yeah, I mean, ideally, if you could get it at least 2 times a week, I mean, a lot of the studies are based on people, so what you're talking about, what you just described at that hotel is very European. So, I grew up in Germany. That's very, like when you go on vacation, like many times it's spa vacation. That's very, very normal for the Germans and the French. And,
There's a lot of like Russians and like Eastern
Bloc absolutely.
Yeah,
you're supposed to sweat. So you go and you sweat. They even have like government sanctioned like sweating paid time, and so a lot of the data is like on in Finland, and they're sweating almost every day. They're getting in there at least 5 times a week. But I mean, when you look at kind of the controlled studies here, most people, it's like, especially Americans, we're not really used to that, right?
We don't have like a sweat culture.
We don't have sweat culture. Yeah. So I mean, you're maybe when I'm encouraging people, because again, it's for them, it's like something they have to go somewhere to do it usually. If you can get it in at least 2 times a week, I mean, the data shows that will at least help you a little, it will help you some. And it's incredibly relaxing.
How does it work here? Does it just call, like if you're going to do that, you just call and make an appointment for when you want to
you just make an appointment.
You like reserve the spot.
You just reserve a spot,
And how long?
I mean, I 30 minutes. We were in there sweating for 30 minutes. And sometimes we have to work you up to that, but 30 minutes is good.
Okay.
Yeah.
I highly recommend. People can just do that, right? You can just
just come here.
Thing,
Yeah. And the other thing before we move on, what you talked about, I mean, there's a lot of good research on contrast hydrotherapy, that hot and cold, and the cold plunge. So you got all of it. It's great.
The cold plunge was incredible. It's so hardcore.
It's invigorating.
Yeah.
Yes.
Like there were two members of our group who were pushing each other to see who could set new records, and they made it for 5 minutes and 30 seconds.
That's really good.
It was incredible. It took them a long. I mean, they paid a heavy price. That was extreme. I was like 2 minutes. I'm out. So another therapy that we're focused on this year is something that again kind of ties into this detoxification focus that we have this year. And that is chelation therapy.
Yes.
Now, it's a very specific type of detox. Do you want to bring that to life a little bit for us?
Yeah, absolutely. So chelation is the binding and removing of heavy metals. So, and that can be done in a variety of ways. It can be done by taking something oral, like, capsules that are targeted for that, or IV. IV is always going to be stronger. It's going to be a stronger, faster treatment. I mean, chelation is not fast by any means, getting the metals out of your body. It's going to take time. Most people, it's like a year or two. People are a little shocked when I tell them that because, again, I think, as you mentioned, or as we talked about before, most people are like, how long am I going to have to do this thing? Oh, at 1, maybe 3, and then boom, I'm done. And this is long term. And the way I like to think of it is that, it took a long time for you to get to that place, like basically since the point you were born. And we even know that babies pick up metals from their mother. So it's really even before you're born, you start accumulating, sadly. And then you keep going, so if you don't start chelating until you're in your 30s or your 40s or your 50s, it's just going to take some time for it to come out.
What are the most common metal accumulations that you see?
I would probably say the top ones that we see are going to be the ones probably people are familiar with, like lead, mercury, arsenic, and cadmium, which is manufacturing. So lead is like, old houses, old paint, old, pipes, things like that, water coming through those pipes. Mercury is like fish, but also silver fillings, which are not really silver, they're mercury.
Or maybe you just played with mercury when you were a
kid. And you played with mercury because it was fun. Oh, absolutely.
It's
Break
cool.
The thermometer.
No, my grandma had like a jar of it, like a lot of it. I probably took mercury baths as a kid, just like laying on top of the mercury pool. Because you won't sink. You float on it. Mercury pool is really cool.
It's fantastic. I mean, they've used it, like, that's why they have Mad Hatter, right? Because they would stiffen those hats with mercury. And so eventually those hatters would like lose their mind because it goes into the brain.
I'm learning things about myself right now. I suspect that I need to get my mercury tested.
You're like, that's what's going on with my brain.
We've been talking about it for a while. I do need to get my metals tested.
Okay. I'm going to pin you down on that one.
Yeah,
so, okay, next.
Just said it.
Yeah, right.
Well, and what you find is that almost everybody, when they're tested, have some levels of some metals that are higher than they should be.
Absolutely.
It's pretty much guaranteed.
It's pretty much guaranteed. You're going to have it. I mean, it's just to what degree.
To what degree, and then how that's maybe manifesting in terms of health conditions. That you said, again, is very personalized, right?
It is.
All this stuff, it's not always like A plus B equals C, right? It's like usually a way more complex algebraic formula,
Way more complex,
That doesn't exactly show, like, oh, you're high in lead. That doesn't mean you're necessarily going to be manifesting these lead symptoms today.
Yes.
But they could just show up, too.
Oh, yeah. What happens usually is like you have an incident of some sort many times. I mean, it can be slow, but somebody catches a virus, right? And it knocks them down and it stresses their system. And then all of a sudden, all of their backup reserves are gone, and or struggling, maybe not gone, but struggling. And then all of those underlying things become important because, again, they take your energy, basically, and your body's ability to heal. So, I mean, you have to, that's, to me, it's like, I mean, I've been like a diehard chelation person since the beginning, practicing medicine. To me, it's almost like it's just it makes sense. It's intuitive. Everybody really needs to do it regardless.
You'd put it in that category of fundamental treatments that literally everyone, if you have the means to do it, you should absolutely do it.
You should absolutely do it.
And if it doesn't really matter what age you get started. If you feel like I'm in my 60s or 70s, should I do it? Yeah, absolutely.
Doesn't
you should.
matter.
Yeah. 30s, 40s, 50s, yes.
And I will tell you, not everybody agrees with me. Like, I mean, as my colleagues, I would say not everybody agrees with me.
Big arguments about it.
Fierce
arguments. Chelation arguments. Throw down the gauntlet.
Knock down. Be surprised.
Of course. What's the big debate?
I think that some doctors feel that it's not necessary. That it's sort of like like if people aren't symptomatic, that you should just leave the metals alone and you should just leave them in their stores. They just sit there, and that's not true. There is really no sitting there. They're active, and what that means is that, this is getting a little bit into chemistry, but like when the reason something that is a heavy metal, right, is it pulls electrons from other things. Now, what that means exactly is that it's picking away at your other cells. And so it's always trying to be complete.
It's a drain to
It's a drain. It's always damaging.
And this is where I think we get in scenarios like you talked about, and it's almost like death by 1,000 paper cuts, where you have a number of things that can kind of conspire together then to tip your health into a really negative or have an overly negative reaction to something, right? Get sicker than you normally get and various other things.
Right.
So better out than in.
Yeah, absolutely. And then coming back to just quickly longevity, I mean, we look at the studies around chelation, reduce, like the last major study, reduce major risk of all-cause mortality, which means, like risk of dying of everything went down in the study. And that was through the National Institute of Health. Our government actually put it out there. It said people who did IV chelation over 40 treatments had significantly less risk of dying of almost everything.
40 treatments?
Yeah.
Is that, it's hard to say what standard is, right? Because it really depends on how a person responds.
Yeah.
But chelation is one that, to your point, you think about, you're going to do it every month or every 3 weeks for a year.
Yeah.
Type deal.
Exactly. Yeah. Most of the big studies are 40 treatments.
Okay. Interesting.
Yeah.
Now, there's something I want to talk about that's really exciting and totally new, and it's not detox really related as much. But before we do that, I want to throw a curveball at you.
Okay.
And ask you, have you heard about peptides?
Yes, I have heard about peptides, but not enough to like speak on it.
Okay. So
yeah.
So
I've got some homework.
Because I read an interesting article about peptides.
Okay.
And it's the new fountain of youth type energy thing.
Yeah.
Because it stimulates growth hormone, HGH, naturally.
Okay.
Without getting HGH, which can be problematic.
Right. Well, I do know about one of those. That's Somorelin. That's the growth hormone precursor. So we have used that.
Okay.
And that's been pretty cool.
I want to put it in the guinea pig category. Peptide treatment. I want to try it.
But you know what? Well, see, this makes sense because anything good, that's probably why the FDA has been coming down on it. I have seen that. The FDA
I read a great article in Town and Country, okay? Very scientific.
No, and I'm not defending the FDA. Please, that's
Very
not what
scientific
what I'm
article.
saying is that usually when things are really good, the FDA gets involved and tries to do something about it.
They want to regulate it.
They want to regulate it. Yeah,
exactly. Well,
okay,
we're going
that's
to come
a deal.
back to that. Peptides,
yeah, we are. Okay.
Future episode.
Yes,
peptides.
yes.
Okay, so finally, we have a kind of a new treatment in clinic that is a new direction for us as well, which is really, really exciting. Why don't you tell us a little bit about what it is?
Yeah, I'm super excited. Well, so this is a whole other thing. This kind of gets outside of detox and
what's the new direction?
Yeah, a whole new direction. So I should say it's an add-on, right, to what we're already doing, and a new focus. We're starting doing more cosmetic, and specifically we have the
rejuvenation.
Yeah, cosmetic.
Really
thank you.
About.
Yes. And specifically, we've brought in the Potenza Microneedling Radiofrequency device, which is way cool, and I'm super excited about. So
it's like the Tesla of microneedling.
It is the Tesla of microneedling. Yes.
Yeah, and it's not that we got it because of this, but it's all the rage.
Yes. Kim Kardashian,
the Kim Kardashians of the world and stuff.
That's right. Yeah, right. If if Kim loves it, then it's got to be good, right?
It's good. Kim loves it. Money is no object. Beauty is the only thing that matters. This is what she uses.
Yes. Yeah, which is true. So this one is different. I mean, there's microneedling, which is, the purpose of it is to stimulate collagen and skin tightening and rejuvenation, basically.
This would be like a natural way to kind of rejuvenate the skin, reinvigorate it. Collagen depletes as we age.
Yes.
Leads us to skin feeling a little bit more and looking a little bit more
like loose,
saggy,
dry,
wrinkly.
That's right. Yes. So we always want to be, yes, we do lose it. We lose it, and it does become more obvious in the thinner places. And so, so what's cool about this is that in addition, so the standard microneedling, that radio frequency actually will heat up the skin, and make that treatment much, much more effective, and especially then if you combine the research that we know about, because we'll be doing it, we don't have to, but we can do it with PRP.
I was going to say, it's not just the radio frequency.
Yes.
It's not
yes.
just the microneedling.
That's
we
right.
can take it to the next level.
That's right. You can add the PRP, which is platelet-rich plasma, which is like stimulates stem cells. And you can actually also inject stem cells, the amniotic stem cells as well. So
you can do all of it.
You can do all of it. Maybe even peptides. I don't know.
Maybe
I'm going to look into
peptides.
that.
We're going to find out.
Yeah, absolutely.
Well, you're getting an IV.
Yeah,
with
that's
the
right.
NAD.
It's all possible, absolutely. Yeah, actually, we found that we really like considering, adding one of those nutrient IVs with the cosmetic treatment, just because, repair, like you have to have a certain amount of like level of vitamins and things like that to kind of, your body's going to pull on all of that, vitamin C and zinc and your Bs to do that repair. So
right. So it's really, in some ways, it's this very localized, very precise treatment process that utilizes microneedling and radio frequency. And then if you're also opting in for the PRP, then to create some, it's not damage to the skin per se, but it essentially it's triggering the skin's self-repair, self-renewal mechanisms.
Yes, exactly.
So it's without using exterior chemicals or fillers or things like a Botox type of thing, and it produces a different effect. And typically, it's I think a couple treatments, right?
Yeah, I think the recommended is 3 to 4. That's pretty standard with any sort of microneedling, approach, and it's the same with the radio frequency, and it's the same really with PRP. PRP is really 2 treatments at least, and probably 3 is more ideal. And the thing is that you're going to see it does take a little bit of time, so it takes time for that skin to start repairing. Like you said, there is kind of it's not cellular damage, but you're right. It's like it's initiating the repair process.
It's like hitting the reset button.
Yeah.
It's like if you reset your iPhone, it takes a few minutes.
Yes,
So,
well,
the
yeah.
little
yeah.
line comes,
That's
the
right.
Apple sign comes, it takes a couple. This is the same for your skin.
Yeah.
And generally, if you're going to get 3 treatments done, and there has to probably be some downtime, heal time between those treatments.
Yeah.
What does that span? Is that once a
So
month,
typically,
or?
like every 4 to 6 weeks really should be back in, because you do start noticing, like it's about the 4-week mark that you really start noticing. And I know, different, obviously cosmetic treatments are different. Like if you get, the laser, if you get, an extreme, like a CO2 facial, something like that, it's, you're gonna, the research, it's going to slough off. And then within a week or so, you're like, oh my gosh, it's
right.
amazing.
But you can't also go out for that week either,
That's true.
because your face is just horrific.
Right. And you can go out, like I would say the next day after this treatment is definitely safe,
I'm excited to try it because I did the PRP microneedling, which I thought was a cool experience. And so I'm excited to see with the addition of the Potenza, it really then elevates.
It's intense. It's good.
It
like a good
that.
intense.
Yeah, totally. It's intense. You said, it elevates the results and really, really causes your skin to thrive.
Yeah.
See how I did that? I put our podcast name right.
I like that. Very good.
That's my
You're good
goal.
at that.
Every single podcast, I'm going to try to work the podcast name into a sentence.
I like that. I think, because I don't think that'll be challenging, so you should probably do it at least 3 times.
Oh, man, that would be hard. Well, I'm pumped for these treatments. I think that looking at the year, I think it's really exciting. So whether you have a detox goal or whether you just have like a health goal and some of these things trigger, and it's like, oh man, this would be something I'm really excited about. That's what I love about what we do here. There's so many options for people, and there's so many possibilities for people to find healing or to move themselves closer to the life they feel like they want to have and should have. And now I think with something like Potenza, we have this new way to help people feel even better about how they look and about how their skin looks and about controlling that factor. And I think it's fantastic.
It's super exciting. And the last thing I'll say about the Potenza is that skin tightening is part of it, which is not usually with standard microneedling. And so you can do other areas like back of the arms. You can treat scars. You can treat, neck area and the décolletage, which is, the skin, like for women, like the chest, right? And then bellies for women that are kind of post baby.
Just kind of pulls the skin in.
Pulls things in. It tightens. Yeah, it just tightens the skin. And that should last about a year after you have the few treatments. So, excuse me.
Interesting.
Yeah.
That's a long time.
Yeah.
That's great. So alternative to things like, different obviously than a surgical procedure, but these are ways that you can create some improvement. Maybe if you have a problem area or an area that you feel like needs some tightening, or you really, because we all have these spots in our bodies that we just don't like.
Yes.
We're like,
again, like you said, could use a little, like you do I have friends and, people that I know that go, oh, the back of the arms, especially when you reach, maybe a certain age that you're like, well, I'm doing all the I'm doing
my triceps.
I'm doing all the stuff. And there's just an area it doesn't seem to tighten. And so this is a way to kind of get in there, and it will kind of, move that skin up. It's pretty cool.
That's cool.
So, yeah.
Yeah. Well, a lot more to talk about with Potenza. I can't wait as we start to get ready to launch that here in February. I think we're going to start rolling it out as an offering to clients, kind of a soft launch, and start, giving that as an option to people.
Yeah.
It'll be great to have some more stories we can tell about the impact that it's having for people and bring that back.
Yeah, I'm excited. I'm excited too.
Absolutely. Well, 2022 is going to be a great year. I'm excited about these treatments. There's a number of them that I cannot wait to get personally. I'm added NAD to my list. I'm going to make my infrared sauna appointments. I got to get the heavy metal testing done so I can get the chelation therapy going. And I can't wait to get
a report back. We're going to do your levels and report back.
So that's everything but ALA.
No, we'll just throw that in there too.
We'll do all 5, and then like 6 months from now, I'll come back. I'll be a superhuman. All right. Well, thank you. This was fun.
Yeah, it was great.
We will talk soon on our next show. Until then, elevate and thrive and live your best life. We'll see you on the next show.
See you next time.